menopause. It was this all along.
What we find is in India, women reach menopause. Average age of menopause is around 46, 47 years.
Very young.
And in the US, it is about 5 or 6 years later.
How old were you when you went through menopause?
Now you're getting personal, right? So it was, I don't mind, but I think it was around 49 years. And therefore now there's a lot of importance on women who are living between 50 and 75 to have a good quality of life. And that is where the focus has come onto menopause. I was on the team of US consulate. So a lot of those, when the US embassy was at Rich Candy,
Yes.
all those women used to come to me and they had no trouble getting pregnant at 42. Whilst Indian women would have trouble getting pregnant at even 37.
Why are Indian women more affected? Menopause. Every woman will go through it. Most will go through it alone. Not because there's no one around, but because nobody talks about it. Not mothers, not doctors, not friends. Certainly not the women going through it themselves. So we're starting here with the basics, with what it actually is, what it actually feels like, and why so many women in India spend years not knowing what's happening to their own bodies. Our guest today has spent over 40 years in gynecology. She is the director of Gynac World and the Center for Women's Health and Fertility and a consultant at two of Mumbai's most respected hospitals, Breach Candy and Jaiswal. She founded the PCOS Society of India, chairs the Metropolis Foundation, and serves as vice president of the Asia Pacific Initiative on Reproduction. She holds some of the most distinguished credentials in her field: MD, FRCOG, FCPS, FICS, FICOG, and has spent her years and career making sure women don't have to navigate their health alone. She has lived through menopause herself. Dr. Duru Shah is here to give us the conversation most Indian women never got. A very warm welcome to Dr. Duru Shah. Thank you so much for being here, Dr. Duru Shah.
My pleasure.
How is your day been so far?
It's been great, and I'm looking forward to the rest of the day. And I'm definitely happy with whatever's going on.
Not too much of a trek for us to get you here.
Yeah, it's been quite a distance, about 13 kilometers, but which took me 36 minutes.
In Bombay. Not so bad,
yes.
right? So I'm going to go directly into this, and I'm going to take you to your early years. When you were studying gynecology, how much of your program was actually dedicated to the study of menopause?
See, during those days, this is way back in the 70s, right? We are talking about 50 years ago.
Right.
There was not much on hormones available. There was no information on different types of hormonal disorders. And the focus was entirely on childbearing and maternal health. So even the government of India was focusing on women who are dying during childbirth. And their entire focus was that, and they were not at that point in time also interested in talking more about menopause or supporting menopause. And the fact is that we did not have much scientific information at that time. And therefore, as the years went by, when hormones started getting measured in the clinical side, say research was on, but on the clinical side we didn't have much available. And therefore, there was no way we could detect the patient's problems and, understand their issues. And women themselves were not concerned about it. They just thought it's the heat, which makes them sweat.
It was life, right? It was actually life. Like you just went through
that
a
was
phase of
normal life, right.
And no one really thought too much about it.
No.
And that was it.
Yes, absolutely.
So when did this draw you in? Because you are a menopause specialist. And obviously you felt the need to go back and learn and study about it. When did that happen?
Yeah.
Why did that happen?
So that was the era, you see, between the 71 to the 80. There were a lot of advances in the field of gynecology. So reproductive gynecology, that is the assessment of hormones in women, ultrasound in women, fetal monitoring during labor, there were a lot of things, endoscopy, laparoscopy, everything came in between 71 to 80. And that is when we were training, and everything was in its nascent phase. But as the years have gone by, there's been so many advances. As you know, every day there are some 100 new things happening. So, therefore, today we are in a space where we can actually identify what are the causes of the problems of women as they age or as they grow older. And therefore, and even women, if you see, go back to 1940,
Yeah.
I think, or 1950, when women did not live beyond the age of 40
Correct.
because they were mainly dying during childbirth and men were dying in wars. So, now that women are living longer, they are living almost to an average age of 73 to 74 years. They are spending the next 25 to 30 years of their lives after they have stopped menstruating. That is when the science has grown, research has grown, the facilities to evaluate have grown, therapies have come in, and therefore now there's a lot of importance on women who are living between 50 and 75 to have a good quality of life. And that is where the focus has come onto menopause.
So that's why you sort of decided to specialize in it, because
Yes, I was always interested in reproductive endocrinology. So anything which involves hormones, I'm interested. That means I'm interested in premature menopause, infertility, polycystic ovarian syndrome, any hormonal issues which affect a woman's health. I'm interested.
Did you also find that there were not many doctors who were in this field, and that was also something
Yes.
that led you into this? Because
Yes. Actually, that's got me interested when I learned more about hormones. Luckily, I was working at the Wadia Hospital, which is close to the Institute for Research and Reproduction. And in my days when I was on duty at Wadia, I used to go in the evenings to the library because we did not have access to the latest journals. I would go sit there in the library and then read on all the hormones, etc. And I was very interested in it. And that's how I got interested in the field of menopause also.
so I'm going to kind of go back in and sort of ask you about your own experience. How old were you when you went through menopause? And what were your symptoms? Or was this something very, very silent for you?
Now you're getting personal, right? So it was, I don't mind, but I think it was around 49 years. And not too many symptoms. It was more related to a lack of energy. It was more related to some not sleeping well at night. And since my knowledge on menopause was pretty good, as soon as I reached menopause, I knew it's menopause, I immediately started with my therapy. And that's how I could overcome a lot of issues and could lead a better quality of life and could maintain myself both mentally and physically even till today. So in short, I think the knowledge helped me a lot. And I think that's the reason why I'm very keen even to create awareness amongst other women that there is much you can do to have a better quality of life.
Yeah. So you mentioned therapy, and I just want to touch on it. But what was the therapy that you sort of gave yourself to feel better at that stage?
I think it was mainly hormone replacement, or what we call today menopausal hormone therapy. And that is something which helps you a lot in terms of managing your life, managing all the symptoms, managing your energy levels, reducing the problems which are associated with menopause. And I think that's how it helps. Of course, it's not mandatory for every woman to take it. But I was also taking it because I myself was quite well informed about it. I knew what benefits it has, I knew what risks it had, and I was evaluating myself regularly once a year, getting my annual checkups done, making sure I'm in the right state to take therapy. And that is something which I feel is extremely important, because today, at least, there was a study done which was related to the Women's Health Initiative, which was done in not the very correct way, and it gave wrong results, and an alarm bell went out into the whole world: stop hormone therapy.
And this was the US
Created a
FDA?
huge fear amongst people.
We're talking about the black box warning sign.
Yeah, that was the thing, and it created a huge warning and huge this thing that everyone needs to stop. And that is when we dissected that that article and
Yes.
understood how the study was done,
Yes.
we had realized that the subjects they included, or the women they included in those what you call included in the study, they were not the right category of people. They were 1/3 of the women were already having high blood pressure, were having other symptoms, cardiac problems, etc., which is not the right way to do it.
Right.
It's ideally done for women where hormone therapy can be given quite safely without any other problems being there. So I think that negated a lot and went against the therapy. And women, when they hear the word hormones,
Yes.
they're all very frightened. Even to take oral contraceptives, they're scared. So what
Yes,
do you
it's
do?
a strange thing, right? Why we have that. I mean, I think so many women, but this is 20 years ago you're talking. So you had obviously got enough information.
Yes.
And you were comfortable, and you're a doctor, and you were
Yes.
comfortable enough to actually administer that to yourself.
Correct.
With confidence.
Yes.
That's pretty incredible, because I think people today are still struggling with that, right?
Absolutely.
And today that FDA warning, has sort of come off, and
Yes.
yet women are scared. Very, very interesting. I'm going to sort of move us along a little bit, because I really want people to understand over here, Dr. Duru Shah. Women go through perimenopause before they go through menopause.
Yes.
What is perimenopause, and how much earlier does it start for women?
See, when we use or define the term menopause, it means the woman has not had her periods for more than a year. Now, there are many reasons why a woman may not have a period, but we take it's a presumption that when you reach at a certain age in your late 40s,
Yeah.
you may stop getting periods, which earlier, when we talk about perimenopause,
Right.
it starts about 3-4 years earlier. And we can confirm menopause only after 1 year of no period. So the years before that is the perimenopause,
It's
or
called
the
perimenopause.
menopause transition, wherein the periods may come early. In the earlier part of perimenopause, the periods come frequently, every 21 days,
Right.
and then they may be a little erratic.
Right.
But as the years go by,
Right.
they start getting scantier,
Right.
they start coming in later, and then finally a day comes when for 1 year there's no period. So that is the normal situation. But women misunderstand menopause as when they have problems with heavy periods, they have too many problems, pain, heavy periods, bleeding. That's what they call menopause, which is not correct.
That's not correct.
That's not correct.
So you're saying menopause is, just to be clear for our audience, is when your period actually stops and then doesn't come back for a whole 12 months.
Yes.
That is what is defined as menopause.
Yes.
And anything prior to that, erratic periods, heavy flow, etc., is all coming into perimenopause.
Yes.
Is it possible, I've heard this as well, and please point this out if this is inaccurate, that women can go through perimenopause 10 years, up to 10 years before they go into menopause. Is that accurate?
It can happen, but when it happens before the age of 45,
Right.
we call it an early menopause.
Okay.
And if it happens before the age of 40, we call it premature ovarian insufficiency. So there is a terminology labeled according to age.
Right.
Now, what we have realized is ethnicity-wise, we are Indians, we are basically from Asia,
Right.
and there are women who are from Europe and from the US and Australia. There's a difference in the age of menopause between these two ethnicities, or these different ethnic groups. What we find is in India, women reach menopause. Average age of menopause is around 46, 47 years.
Very young.
And in the US, it is about 5 or 6 years later. So
Why?
it's around 53. Now that's genetic. It's nothing else. It's purely genetic. And that is something which affects us, because I remember that when we were treating our patients for infertility,
Yes.
we used to find that 10 years, before, by 35, it was difficult for us to get those women pregnant. We had to really put in efforts to help them. Whilst women who were living in the city of Mumbai, Europeans, Americans, by the way, I was on the team of US consulate. So a lot of those, when the US embassy was at Breach Candy,
Yes. Yes.
all those women used to come to me, and they had no trouble getting pregnant at 42. They got pregnant. Whilst Indian women would have trouble
Struggling.
getting pregnant at even 37. So it used to bother me, and I used to wonder why. And once, whilst I was at the Stanford University, I spoke to that professor, the head, and I asked her, why is this happening? And she also couldn't understand it. But many years later, she published a paper on this. And she called me up and she told me, Duru, I've been thinking about this, and now I've proved it, that Indian women reach menopause earlier, about 6 years earlier. They compared Spanish women to Indian women, and found that the fertility potential plus the menopause age, everything is 5 to 6 years earlier. And the reason I'm bringing this out is because women in our country, we must realize that after 35, 30, they should try and have their children before 35.
Right.
I know it's easy to say that because so many women are into careers.
Right.
And nobody
absolutely.
wants to get pregnant at that time.
Exactly.
So that's where we come with so much on fertility we can
So
do.
your advice to those women who want to then, have their careers and not have children, you'd say, well, have them earlier.
Either have them earlier or freeze your eggs.
Or freeze your eggs.
That's it.
Okay. Coming back again into menopause, can you, or perimenopause, because I think the symptoms you mentioned are almost the same. What are the symptoms? I mean, beyond the hot flashes, which everyone talks about, or the night sweats, what are the other symptoms that a woman could possibly be experiencing?
So if I explain a little bit of the pathology or the normal physiology.
Yes.
You see, any hormone produced in the body, okay, for it to act, it has to attach itself to a receptor. Means it's like a lock and key. And the receptor, when the hormone attaches to the receptor, then that hormone can function. So we have estrogen receptors all over our body, which includes the hair, the skin, the nails, every tissue in the body. And therefore, when ovaries are producing estrogen, that's a female hormone, it's acting at every level of the body. It's acting at the brain level, at the skin level, the hair level, the heart, the bones, everything. And therefore, when that estrogen deficiency starts occurring, because in a woman, ovaries start producing less and less of estrogen as they grow older.
So post 35, you'd say?
Post 35, fertility gets reduced, but maybe the estrogen function continues, but not to the same level as a 35-year-old woman. So when the estrogen is almost gone from your system and there are no, sort of eggs left in the ovaries. Ovaries have two functions.
Yes.
One is to produce children, may produce eggs for having babies.
Right.
And one is to produce a female hormone, estrogen.
Estrogen.
When the ovaries are failing, or failing means gradually going into a slow
Decline.
that's when the hormone production, which is reducing, it affects the rest of the body. So it's affecting the brain in terms of lack of sleep, lack of memory, brain fog, all those things happen. So, then it acts on the skin. It causes wrinkles on the skin. It will cause, pigmentation. It could cause, different issues where the skin is concerned, laxity.
Right.
Then it can act also on the bones, where your bones get weaker. They are not as strong as the younger bones, or the ones which are with estrogen. Acts on the heart, gives rises to problems with the heart issues, means earlier heart attacks. It can give rise to insulin resistance, wherein there's more fat collected here in the abdomen, in the upper abdomen. And these are the so many things which occur because of lack of estrogen.
So a woman going through brain fog who is being dismissed, this is real for her.
Yes.
Because it is happening because of estrogen loss.
Absolutely.
A woman who is perhaps gaining weight during this time, this is perhaps because of the insulin resistance that's happening, again because of estrogen loss. Her risk of dementia is going up. Her risk of heart attacks is going up.
Yes.
And her risk of bone density, in other words, she could, if she falls and fractures or breaks her bones, goes up. So these are the other things that are happening. The actual symptoms that are happening to her. What would they be, like beyond the hot flashes? And what would those also be?
So those hot flashes are basically symptoms because of the effect of the brain. Estrogen on the brain is getting affected.
Right.
It affects the temperature control of the body. So that is one. So you get the hot flashes.
Right.
The second is that lack of sleep.
Yes.
So that is again brain level function.
Right.
So all these functions which are affecting the brain temperature control, hot flashes, brain fog, lack of sleep. All these are related to the brain. Then you have the reproductive functions. Like say for example, the periods start getting erratic.
Right.
Then you have problems with the sexual function post menopause,
Right.
where the desire to have sex is gone. That again acts at the brain level.
Is that for everybody, or is that again based on that? Basically, if you're a woman in menopause who's listening to this, what are we taking out? That basically she doesn't want to have sex anymore. Is that what we're taking
There could be
out?
two reasons. There could be because the desire to have sex is initiated by testosterone. That's a male hormone.
Yes.
While estrogen is the one which acts on the vagina.
Right.
And if there's no estrogen, the vagina gets very dry. It becomes painful for a woman. So she doesn't want to have sex because it hurts. So if it hurts, then naturally the desire is not there. It's all connected. You get the point?
But there are solutions to this.
Of course there are
Of course,
solutions.
there are so many solutions. There are today. I mean, you have enough lubricants but the desire has to be there, right?
Desire has to be there if she's enjoying it.
Yes.
But if she's in pain,
No,
she won't have
obviously.
the desire.
Yes.
So the question is that we have different symptoms. So I'm talking about the symptoms which she could have: decreased libido, dry vagina, painful intercourse. She could also have associated urinary symptoms because the urinary tract and the vagina come from the same embryological tissue, and so she may develop a little bit of incontinence. She may want to go to the toilet more frequently, getting up in the night to go to the bathroom, and laxity of the vagina, urinary incontinence and frequency, as I said. So these are the issues associated with the genitourinary tract. Then there could be problems associated with muscle strength. Muscle strength goes down, so she's not able to lift as much. She's not able to have the same energy levels as she had before.
Fatigue is a very common
Fatigue
thing.
is a common, and in India it's more of muscular and joint issues. Many women complain of muscle ache, pain, joints are hurting. These are the common symptoms women in India have. Whilst abroad it is more about hot flashes. Here when they have hot flashes they think it's hot. That's it.
So you talked about muscular skeleton, and you said Indian women are more affected. Why are Indian women more affected?
I think it has a lot to do with probably the nutrition. Because if you see our diet, especially if you're a vegetarian, the chances of a protein deficiency is absolutely possible because they're not having the right food in terms of increasing their muscle strength.
Right.
Indian women are more, sort of reliant on a lot of people to help them at home. I'm talking about the urban woman.
Yes.
I'm talking about the urban woman because we are talking about menopause with urban women. In the rural area also we find similar situations, but there we find different problems compared to the urban women. So I'll talk about urban. And there we find that the muscular strength is not the best. And as we get older, there's something called sarcopenia which develops. That is, the muscle starts getting less and less strong, it gets weaker. And that's called sarcopenia. Till a day comes, that as you get older, even getting out of a chair may become difficult. You may have observed some older person at home trying to get out of the sofa, right? If I get out of this and if I can get out straight, I've got enough muscle strength. But if I have to push myself forward and forward and forward,
And then get
come
up.
the edge of the sofa and then get up with support,
Yes.
that means I have sarcopenia. So it's a nutrition to some extent plus less of physical activity.
So,
Many women don't have any kind of proper physical activity. Some of them are doing yoga, which is good, but some of them are doing walking, which is good. But if you go into the details of what they do, you realize it's not really building muscle strength. And that's extremely important at a younger age, that you start building your bone bank and your muscle bank, so that as you get older, you are in good shape to continue with your exercises, which you must continue. Of course, as you get older, as you age, you're not the same as you were when you were 20 years old. That we have to realize.
no, but would you recommend that if women were to take a more protein-rich diet, if they were to sort of complement the walk or the yoga or the Pilates with weight training,
Yes.
would those things really support their musculoskeleton and therefore?
Absolutely, it would, and their aches and pains would be much less. So, better nutrition, better, healthier lifestyle is important. It's not only medication, it's a lot to do with this also.
Doc, you talked about estrogen loss. If a woman today is in this phase of her life, but she is not having, let's say, the traditional symptoms of, fatigue or sleep, lack of sleep, or hot flashes, or any of those. But you talked also about heart and brain and how estrogen loss affects all these parts or your organs, right? What would you recommend to these women? Would you recommend, I mean, you were one who said you began HRT. Would you recommend taking HRT even if you're having no symptoms? Because it actually affects your body physiologically in such a bad way.
Yeah, no, the thing is that, what is strongly recommended is that what has been found through research,
Yes.
that between the age of 50 and 60, if you take hormone therapy and you take it within that first year when you have diagnosed menopause, the earlier you take it, the better is your bone strength. Well known fact. It has more advantages compared to disadvantages. Now, everything you do in life has advantages and disadvantages. But between 50 and 60, counting that she's reached menopause at 49, confirmed diagnosis at 50, for the next 10 years, if she takes hormone therapy, there is a big benefit. Between 60 and 70, it's like the same as, it would be with others, where there is equal amount of advantage and equal amount of disadvantage. But after 70, it increases the risk of having the other conditions. So in short, what is recommended, that we should take it ideally between 50 and 60 to get the best advantage. But after a lot more research has been done, it has been shown that between 60 and 70 also you could continue it, provided you are okay to take it and want to take it. And believe you me that those women who are on hormone therapy, they don't want to stop it. Even though at 60 we tell them stop, but they won't. So now there's enough evidence to show that even after 60 they take it. But of course, hormone therapy is never taken on your own. It has to be under medical supervision.
Absolutely.
You will never take hormone therapy on your own because you don't know what's brewing inside. So you have to go through an annual checkup. You have to see your doctor regularly and take it under the guidance and medical, expertise. You can't take it on your own.
But I reduce my chances of dementia. I reduce my chances of osteoporosis. I reduce my chances of cardiac disease if I'm actually taking
Yes.
hormone replacement therapy.
Yes. And if you see in India, in Indian women, the chances of metabolic syndrome,
Yes.
that means high cholesterol, high sugars, high blood pressure, obesity, all these conditions are superseding, they're much more as compared to, say, another ethnicity.
Yes.
Plus, if you are menopausal, the problem sort of gets worse.
Yes.
So, in short, it's like double trouble after
Yeah.
menopause, and therefore prevent obesity, extremely important. Keep your cholesterol under control. Again, coming back to a healthy lifestyle and healthy nutrition.
Diet.
That's what it means.
We've talked about menopause. What I actually want to sort of lead into is what is post-menopause? If someone is having symptoms and after this 12-month period of no period, do the symptoms go away? Does she become okay?
No, the symptoms may go away. They gradually fade off, say maybe in a year or 2 years.
Right.
But what is important for her is that she must, sort of still have her annual checkups. Because after the menopause is your aging starting. See, if you look at the animal world, most of the animal world produce children or produce babies till they die.
Yes.
Okay? Whilst in human beings, it's different.
Yes.
Women reach menopause by 49, 50, can't produce children. And it matches with the aging process. And therefore, people, tend to think that menopause and aging go together, which is not actually true. It just happens at the same time. Whilst men reach andropause after 70. They can produce children even till the age of 70. Women can't. And estrogen is the hormone which is protecting them, protecting their heart, protecting them till the age of 50. So if we see cardiac disease in India, between 40 to 50, you'll find more men dying of heart attacks compared to women. Whilst after 50, they equalize. Because that estrogen protection has gone.
My gosh.
And therefore, we keep all these factors in mind, and we say that yes, we must have an annual checkup, rule out cancer, early detection of cancer, very important. So we do pap smears, we do ultrasounds, look at the ovaries, look at the uterus, because you can have something called postmenopausal bleeding. If you have stopped periods for a year and then you start getting your periods again, not really period but erratic bleeding, then it's a cause of concern. You have to see your gynae. You have to make sure there's nothing going wrong with the ovaries or the uterus or the cervix and the reproductive organs, and make sure that there's nothing going wrong. So in short, many women ignore it, and that is a message going out that please see your, not necessarily gynae, but at least see a doctor before, if you, every single year, you must.
So in short, post-menopause women, it's not a bullet where everything becomes okay.
No.
Symptoms may continue even though you are considered postmenopausal. If you start bleeding again, that's not a good sign. It's not like, oh my God, I've stopped menopausing. Go back to your doctor immediately.
Yes.
Okay. Last question, Dr. Duru Shah. Many women feeling hopeless, helpless, not knowing what is happening to their own bodies. And for a woman listening right now, what is that one piece of advice that you would give her?
I think after she's listened to this podcast, I don't think she needs any more advice. But yes, I would tell her, please see your doctor or whoever's your gynae. Your life doesn't end with having children. You have your children and you say, oh, why do I need to go to a doctor? The only time they go to the doctor is when they're pregnant and when they deliver.
Right.
Following that, they don't. Even if everything is normal, you still need to go for your annual checkups, for detecting early cancer, for detecting osteoporosis, preventing diseases for later. In short, that's what I'm trying to say. So, and there's so much more we can do for women today as compared to the past. So don't fret, don't be worried, just get a proper consult, see the right person, don't go to ChatGPT. There are many doctors who put up a board outside. If you are following Google, please don't enter. So in short, see the expert, get your treatment, or management done, and I think you'll be a happier person.
Thank you so much, Dr. Duru Shah.
My
really,
pleasure.
really appreciate your time.
Thank you. Thank you so much for having me.
So you heard this from Dr. Duru Shah. Menopause is not a malfunction. It's a shift every woman goes through. You are not going crazy. You don't need to navigate this alone. Help is available. That's what today was. We'll be back. For anyone looking for help and wanting to reach out to Dr. Duru Shah, her email ID is mentioned in the caption below.